Advanced practice nurses lack access to role-appropriate health informatics or clinical informatics fellowship opportunities as compared to physician colleagues. This oversight obviates potential advanced practice nurse health informatics opportunities and advancement. Advanced practice nurses and patients would benefit from the creation of focused clinical informatics education relevant to advanced practice nurse practice. It is unclear why this discrepancy exists. An understanding of the clinical informatics needs of advanced practice nurses is required. Is the lack of advanced practice nurse opportunities in clinical informatics reflective of the larger issue of lack of women in technology? Nurse practitioners have not had the same opportunities as physicians in health informatics, especially clinical informatics. Clinical informatics is defined as the application of informatics and information technology to deliver healthcare regardless of profession. This supports the idea of subspecialty training across disciplines. Nursing and medical informatics are distinct informatics specialties with national certifications. The lack of APN practice-specific health informatics body of knowledge or policy has enormous implications for APNs and patients alike in a data-driven world. All healthcare providers, including APNs, require relevant informatics knowledge to effectively facilitate healthcare. What is biomedical informatics, and why should advanced practice nurses have equality in informatics advancement opportunities? Even non-nursing organizations have voiced concern about the challenge to maintaining the healthcare informatics workforce. Healthcare Information and Management Systems Society, or HIMSS, a leading informatics organization, recognizes it is critical that all nurses upscale from informatics to data scientists. The health information technology sector has grown substantially over the last several decades due to a shared public, industry, and leadership mental model that assumes investments in health information technology improve health. 2 decades ago, the Institute of Medicine report To Err is Human and Crossing the Quality Chasm advocated for healthcare redesign and technology integration to improve patient safety. The National Focus on Safety believes that the adoption of electronic health records could reduce medical errors. Accordingly, the increased adoption and implementation of electronic medical records necessitated the development and growth of nursing informatics and medical informatics subspecialty areas. Since 1992, nursing has recognized the importance of the development of nursing informatics, as evidenced by the creation of nursing informatics national organizations and certification programs. Similarly, in 2011, the American Board of Medical Specialties approved the development of medical informatics fellowships. There are differences, as expected, between medical and nursing informatics based on practice scope, role, and clinical practice. In 2006, the Technology Informatics Guiding Education Reform, or TIGER initiative, identified basic informatics competencies for nursing. This initiative focused on electronic medical records training, but did not address the analytics relevant to advanced practice nursing or APN practice. I propose that APN leaders and educators should explore possible APN clinical informatics fellowship opportunities separate from nursing informatics training. Additionally, there should be subspecialty certification development that integrates relevant APN scope clinical informatics concepts. The AMA recognized that healthcare providers need specific skills to leverage data across the continuum for innovation. There are many avenues for physicians in training and practice to acquire and improve health informatics skills. The American Medical Informatics Association, as an example of the medical education's commitment to health information technology, offers 47 accredited medical fellowship programs across the country for physicians. To my knowledge, there are few, if any, clinical informatics fellowships for APNs, on par with physician medical informatics opportunities. What is interesting is that the National Center for Data Statistics even lists a code for a clinical informatics nurse practitioner residency or fellowship program, despite the paucity of actual APP informatics fellowship programs. Unfortunately, there are no illustrative examples, but clearly others have identified the need for clinical informatics fellowships for nurse practitioners. In 2011, the American Board of Medical Specialties designated clinical informatics as an eligible medical subspecialty available to physicians already certified in an ABMS recognized specialty. In 2023, board eligibility for physicians will also require the completion of a clinical informatics fellowship approved by the Accreditation Council for Graduate Medical Education. Although there are certifications in nursing informatics, often this content does not reflect the needs of advanced practice nurses. Nursing informatics, as defined by the American Medical Informatics Association, is the science and practice that integrates nursing, its information and knowledge, with the management of information and communication technologies to promote the health of people, families, and communities worldwide. There are several problems with the definition. It is unclear if the AMIA Nursing Informatics Special Interest Group had advanced practice nursing representation. The Doctor of Nursing Practice, or DNP Essentials, has a more comprehensive description of DNP information and technology. The DNP Essentials requirements for information and technology, in my opinion, underestimate the skill sets and knowledge needed to meet these requirements. Advanced practice nurse, or APN, leadership and educators can learn a great deal from the experiences of physicians. The American Medical Association, or AMA, has acknowledged that few physicians were fluent in data. They recognize that while providers are skilled at entering electronic data, they are not always proficient in other areas of health information technology. The AMA realized that clinician health information technology skills require cultivation starting right from medical school. Medical education requires students to receive specialized training to interpret data. There are areas of overlap among physicians and nurse practitioners. Advanced practice nurses routinely utilize algorithms and analytics similarly to residents. Advanced practice nurses would benefit from access to clinical informatics opportunities for postmaster's education on par with other healthcare disciplines.